Hey everyone, welcome back to the channel. It's Nurse Blake, and today we're diving into a crucial aspect of healthcare: patient safety. Audits can sound intimidating, maybe even a little scary at first, but they're actually our best tool for patient safety, a proactive way to ensure we're providing the highest quality care. Instead of finger-pointing or assigning blame, audits help us spot ways to prevent infections, identify potential hazards, and keep everyone safe. Patients, visitors, and staff alike. We focus on three main types: environmental, ensuring a clean and sanitary environment; infection control, preventing the spread of germs and disease; and hand hygiene audits, the simplest yet most effective way to stop the spread of infection. All of these audits are based on CDC and WHO guidelines, ensuring we're following the best practices in healthcare. Environmental audits check if patient areas are truly clean, looking beyond just surface appearances. Infection control audits make sure we're using PPE, like gloves and masks, and following protocols for everything from medication administration to wound care. Hand hygiene audits ensure we're washing hands at the right times with the right technique. The key? Build good habits into your daily routine, make them second nature. Don't just prep when an audit is coming. Patient safety is an everyday commitment. Know your hospital standards inside and out, and always remember the 5 moments for hand hygiene. This guide will walk you through each audit, providing a clear understanding of the process with practical tips to make you a patient safety champion, advocating for the well-being of your patients. Let's get started and make a difference in patient care. Let's jump into the environmental audit process. Think of it as becoming a cleanliness detective, searching for clues to ensure a safe environment. The goal is simple, yet critical. Make sure every surface and piece of equipment is thoroughly clean to prevent the spread of infections and protect our patients. Use your facility's comprehensive checklist. Based on the latest CDC recommendations, it's your guide to a thorough assessment. This checklist will guide your inspection, ensuring you cover all the essential areas and protocols. Check those high-touch spots meticulously. Bed rails, a common contact point; IV poles, frequently touched by both staff and patients; call lights, and more. Don't overlook any area that's frequently used. Know which specific cleaning products are approved for each surface, and understand exactly how to use them for optimal disinfection. During the audit, observe the cleaning process quietly, and always respect patient privacy and their personal space. Mark each item on your checklist as either clean or needing attention. Document everything clearly. Be honest and objective in your assessment, providing constructive feedback. Missed spots aren't failures or cause for blame. They're valuable opportunities to improve our cleaning protocols and practices. Share your findings openly and collaboratively with environmental services and nursing leadership to ensure everyone is informed and aligned. This teamwork helps target training efforts effectively and allocate resources strategically to areas where they are most needed. Remember, every audit, no matter how small, contributes to making your unit a safer place for everyone. Now, let's talk infection control and hand hygiene audits. Infection control audits check if we're following protocols like PPE use and proper handling of lines. Hand hygiene audits focus on whether we clean our hands at the right moments, following WHO's 5 moments. Observe quietly, watch for correct actions without interrupting care. Use your audit tool to tally compliance, not to single anyone out. The goal is to see how the team is doing overall. Share results positively, like celebrating 85% hand hygiene compliance and aiming higher next month. These audits help us stop the spread of germs together. Simple actions, big impact. Finished your audits? Great. Now comes the crucial part: translating those observations into meaningful action. It's not enough to simply identify areas for improvement. We need to actively work towards making those improvements a reality. Here's where real change happens. This is where we move from identifying problems to crafting solutions together. Share the audit results openly and honestly with your team, but always in a supportive and constructive way. Remember to focus on the systems and processes that contribute to errors, not on blaming individuals. It's about improving the overall environment. Carefully use the collected data to spot trends and patterns that might otherwise go unnoticed. Look for things like missed bed rails, which can pose a significant safety risk to patients, or instances of low hand hygiene compliance before patient contact, a major factor in infection control. Brainstorm potential solutions together as a team. The best ideas often come from collaborative discussions. This might involve creating new checklists to reinforce best practices, or simply ensuring that hand sanitizer dispensers are conveniently and strategically placed throughout the unit. Implement small, incremental changes, one step at a time, then conduct a follow-up audit to see if those changes are actually leading to tangible improvements. This continuous cycle of feedback, action, and re-evaluation is what builds a strong and sustainable culture of safety. Remember, every audit you conduct is a valuable step toward ultimately achieving fewer infections and significantly better patient outcomes. You're not just going through the motions of checking boxes on a form. You're actively protecting patients from harm and contributing to their well-being. Embrace these audits as a valuable opportunity to take the lead on safety initiatives within your team and organization. You're a vital and indispensable part of the healthcare team, working together to create a safer environment for everyone.